Dear friend, today we will see the cavernous sinus. This is the cavernous sinus. This cavernous sinus is one of the dural venous sinuses, or a category of the pair venous sinuses, which is situated by the side of the sphenoid bone. This is the sphenoid bone here. Okay, this is the sphenoid bone. Here, this is the sphenoid bone. This is the side of the sphenoid bone, extending from the apex of the petrous temporal bone up to the superior orbital fissure. This is the superior orbital fissure, petrous temporal bone. Okay, so this extend here. Okay, now why it is called the cavernous sinus? Because interior of the sinus is traversed by the reticular fiber. Okay, here it is. Just if you see the diagram, look here. If you take a cross section here, okay, cross section through the here, or the coronal section passes through the skull, passes through the here the sphenoid bone. Clear? So if you draw the diagram, look here. This is the skull. And this is the sphenoid bone. These are the two sphenoidal air sinus here. Okay. Now, here, this, as you know, the interior of the cranial cavity is lined by the dura mater. This is the endosteal dura mater, which just adhere to the bone. Okay, this adhere to the bone here. Okay, base of the skull or the roof of the skull here. Okay, then here in the interior to this endosteal layer, this is the meningeal layer. Okay, just draw the different color. So just you see here, this is the meningeal layer. Now this meningeal layer, some places it is separated. Okay, it leaves here like this. It leaves the endosteal layer. So the gap which is created is known as the sinus, the dural venous sinus. Same here in the cavernous sinus, when this endosteal layer passes towards the floor of the middle cranial fossa, here by the side of this sphenoid bone, it leaves in ascends upward like this. Okay, it ascends upward, then it passes towards the pituitary stalk, then it winds around the pituitary gland. Okay, like this, and then it passes the opposite side from the roof, and then descends downward, and then from here. So this sinus, which is from here, the two sinuses here, which is along the here, the rectangular in shape, extending from anterior to posterior side, anteriorly from the superior orbital fissure, posterior up to the petrous part of the temporal bone here. So this is here, these are the cavernous sinus, and these cavernous, I told you, they are traversed by in the cadaver. If you see the cadaver especially, these sinuses traversed by the reticular tissue, and that's why known as cavernous, and spongy in texture here. So that's why it is known as the cavernous sinus here. Okay, here. So this is the cavernous sinus. What is the measurement of the sinus? If you see the measurement of sinus, now another diagram here in a whole view here. This is a cross section. If you see the whole view here, okay, I am drawing the whole view here. Yeah. Look here. Suppose this is the cranial cavity. Okay, this is the sphenoid bone. These are the lesser wing of the sphenoid. This is the petrostemporal bone. Here. And here, this is the location of the sinus. Okay. This is the location of the sinus. Now, look here. This sinus extends here from the petrous part of the temporal bone, apex of the petrous temporal bone up to the superior orbital fissure. So this is the superior orbital fissure. Okay, here. So how this sinus extends? Look here. This is the lateral wall of the sinus. Okay, opposite side here. This is the superior orbital fissure. This is the sinus extend anteroposteriorly. Okay, here. So this is a rectangular sinus here. Clear? If you see the dimension of the sinus, this sinus anteroposteriorly is about 2 centimeter and breadth or side to side it is about 1 centimeter. So 2 centimeter long and 1 centimeter is the breadth. Okay, so this is the dimension of the sinus. Now, how this sinus is formed? So, this sinus is formed by the separation of the two layers of the dura mater. As I already told you, if you see this diagram here, this diagram here is shown. The green color is the endosteal layer and the violet color is the meningeal layer of the dura mater. So, when this meningeal layer passes at the floor, here it separates, ascends upward, okay, then medially towards the pituitary stalk. So it forms the roof and the lateral wall of the sinus, which is formed by the meningeal layer, okay, and the floor. And the medial wall, part of the medial wall is formed by the endosteal layer and the part is formed by the meningeal layer, which because it winds around the pituitary gland. So this is how the sinus is formed here by two layers, separation by the two layers here, the endosteal and the meningeal layer here. Clear? Now, so what are the structure? If you see what are the structure traverses through this. Now, before structure, you know that this cavernous sinus is lined by the endothelial cells here. Okay, so these are the endothelial cells. These are the endothelial cells. Okay, here. So whole sinus is lined by the endothelial cells here. So now certain structure passes through this dural venous sinus or the cavernous sinus. Certain structure passes through the floor, certain structure passes through the lateral wall, okay, and also passes through the roof, pierces the roof here. Now look here, what are the structure passes? So just we will draw the first diagram here. Look here, this is the pituitary fossa here. This is a floor. This is the floor. Okay, here. And here, this is the sphenoid sinus divided into the two by the midline septum here in the sinus. Here. Okay, here. And this is the foramen oval. Okay. On the both sides, this is the foramen oval through which the mandibular nerve comes out. Clear? Now, look here. It is a green color and here. This is the endosteal layer. This is the endosteal layer of the sinus, which from the floor. Okay, here. And this is the meningeal layer. Here the meningeal layer is, I think, this is the meningeal layer. Okay, here. This is meningeal layer. And now this meningeal layer separate here, ascends upward and passes medial. And before that here, just you will draw the pituitary gland. This is the pituitary gland. And this is the pituitary stalk. Stalk here. Okay, here. So this meningeal layer here, after ascends upward towards the roof on the lateral side, it passes towards medially, okay, towards the pituitary stalk and winds around the pituitary gland and small part of the pituitary stalk, passes in the floor of the pituitary fossa, then reaches towards the opposite side, and then here it again returns to the opposite side from the roof of the sinus and again descends downward towards the floor and then continue with the dural here endostea, dural sheath here, endosteal layer. Okay, so you can see here, so these are the two sinuses, and these two sinuses are lined by the endothelia. Okay, so you can see this is the endothelia. Okay, so this is the endothelium on the opposite side. Okay, here. So this is endothelium. Now, first is the internal carotid artery. Internal carotid artery passes here in the floor, clear? Here in the posterior part, because it enters through the carotid canal here on the posterior side, you know, here in the skull. Here this is the foramen lacerum and the carotid canal here. Okay, so on the posterior part of the sinus, so this artery passes first through the floor and passes through the floor in the carotid groove here on the lateral side of the pituitary fossa. In the floor of the sinus, the carotid groove. So it runs through the carotid groove here and then passes through the carotid groove, and then when it reaches towards the anterior side here, towards the anterior clinoid process here, it then ascends upward. Okay, here it ascends upward and pierces the meningeal layer, and then it reaches inside the, just near to the brain here, anterior side. Okay, so how this artery passes? It runs first floor, passes interiorly, then ascends upward towards the anterior end of this cavernous sinus, then pierces the roof, then passes through the brain. So this is the internal carotid artery, and this internal carotid artery runs along with the plexus around it, venous plexus and the sympathetic plexus here. Clear? So this is the one structure. Another structure in the floor is the here abducens nerve. Okay, the abducens nerve, the posterolateral to this internal carotid artery in the floor here. Okay, so this is the abducens nerve. This abducens nerve here, actually, it passes under cover the petrosphenoid ligament, then passes through the floor lateral to this internal carotid artery, and then runs in the along with the lateral carotid, this internal carotid artery, then enters into the orbit. So the orbital, superior orbital fissure here. So this is the Sixth nerve, the abducens nerve, which passes through the floor. Okay, so these are the two structure which passes through the floor. So what are the structure on the lateral side, lateral wall of the this cavernous sinus? So certain structure runs in the lateral wall. These are the, if you go superior to inferior side, one is the, these are the nerves. Okay, just I am drawing the nerve with the black color because not visible the yellow color in the light. So first nerve here. This is the oculomotor nerve. Oculomotor nerve, after piercing the posterior part of the here, it comes from the, come from the midbrain. It passes the apex of the petrous temporal bone and then runs in the lateral wall of this cavernous sinus. Clear? Here. It runs in the lateral wall and then reaches anteriorly towards the superior orbital fissure, and in the superior orbital fissure it divides into the two branches, upper and the lower division. Okay, upper and lower division, then it enters through the orbital fissure through the ring. Okay, here, that ring of the gin. So this is the oculomotor nerve. Below the oculomotor nerve here, there is a trochlear nerve. Okay, trochlear nerve same, it runs and above the apex of the petrous temporal bone, then runs in the lateral wall of the cavernous sinus. Okay, here, and then through the and enters into the superior orbital fissure outside the tendinous ring here. So this again, this nerve enters into the orbit through the superior orbital fissure. Then below the trochlear nerve, there is an ophthalmic nerve. Okay, this ophthalmic nerve. Ophthalmic nerve is, the one of the division of the trigeminal ganglia. Okay, here, and this ophthalmic nerve passes through the this lateral wall, enters into the superior orbital fissure, and at the superior orbital fissure it divided into the frontal. Okay, one is the frontal, one is the this nasociliary, one is the lacrimal here. Okay, so these three branches, frontal and the lacrimal division passes outside the ring here, and the nasociliary passes through the ring between the two division of the oculomotor nerve here. So this is the ophthalmic nerve. Below the ophthalmic nerve, this is the maxillary nerve. Okay, maxillary nerve, after passing below the ophthalmic nerve in the lateral wall of the cavernous sinus here, it immediately passes towards the floor and enters into the foramen rotundum here. This is the foramen rotundum here. Okay, so in the foramen rotundum it enters into the pterygopalatine fossa. So these are the four structures which runs in the lateral wall. Mandibular nerve do not passes here, it passes through the foramen oval here. I told you here, this is the mandibular nerve, it passes through the foramen oval outside the cavernous sinus here. Clear? So these are the structure which traverses through the cavernous sinus in the lateral wall and the floor, and certain structure passes in the floor first. This is the internal carotid artery and the abducens nerve, then pierces the this roof, especially the internal carotid artery. Okay. So these are the structure which runs in the lateral wall and the floor of the cavernous sinus. Now, what are the relation? If you see the relation of the cavernous sinus, if you see the medially it is related to the pituitary fossa. Okay, this is the pituitary fossa along with the pituitary gland. Okay, here. Along with the here, in the inferiorly and the medially, the sphenoidal air sinus here. Okay, so medially it is related to the pituitary fossa, sphenoidal air sinus, and the pituitary gland or the hypophysis cerebri. Laterally, if you see the laterally it is related to this cavern trigeminally on the posterior side here. This is cavern trigeminally here, the cave-like structure where the trigeminal ganglia are situated here. So posteriorly and laterally it is related to the cavern trigeminally. Clear? Posterior inferior, and further laterally it is related to the uncus of the temporal lobe. This is the temporal lobe of the brain here. Okay, here. This part is the uncus. Okay, so uncus of the temporal lobe related just lateral to the the cavernous sinus. And the above, if you see the above or the roof is related to the part of the optic chiasma. Here, this is the brain. Okay, here this here this is the part of the brain. Okay, and here is the optic chiasma. This is the optic chiasma. Okay, by the side of the pituitary stalk, anterior to the pituitary stalk. So these are the optic chiasma first, and the internal carotid artery. I told you internal carotid artery pierces the roof. Okay, ascends upward, lined by the sympathetic plexus. Okay, here. So artery first ascends upward, then passes backward here. Okay, it ascends upward, pierces the roof, and passes backward. So it make a turning. Okay, and this turning is the siphon, the carotid siphon here. Okay, so these are the structure which is related to the roof here. Clear? So these are the structure. Now come on the tributaries. What are the tributaries of this sinus? Okay, tributaries of this sinus. Now first draw the diagram. Clear? Look here. This is the petrous temporal bone. Okay. This is the apex of the petrous temporal bone on the both sides. Here, and this is the sinus on one side. This is the opposite side. Okay, so the sinus, and here this is the orbital fissure, superior orbital fissure. This is superior orbital fissure here. Okay. Now, first is this is a superior ophthalmic vein. This is the superior ophthalmic vein, which passes through the superior orbital fissure here. Okay. There's an inferior ophthalmic vein also. The branch of the inferior ophthalmic vein passes through the here superior orbital fissure and here. So these are the two veins, superior ophthalmic vein and the branch of the inferior. And one other vein, the central vein of the retina here. Central vein of the retina passes through the here optic canal and into the sinus. Okay, so this is the central vein of the retina. Yeah. Then there's a large vein. There's a superficial cerebral vein here. Okay, here. So this is the superficial cerebral vein or the superficial middle cerebral vein. Correctly, the superficial middle cerebral vein drains into here. Okay, here. So this is then the few inferior cerebral vein. These are the inferior cerebral vein which runs from the inferior side here, inferior surface of the cerebral hemisphere. So these are the inferior cerebral vein here. Clear? So the superficial middle cerebral vein, inferior cerebral vein. Okay, here. Then the sphenoparietal sinus here. This is which runs along with the sphenoid, lesser wing of the sphenoid bone here. Okay, here. So this is a sphenoparietal sinus. I am drawing opposite side here. This is a sphenoparietal sinus here. And the anterior trunk of the middle meningeal vein here. This is the middle meningeal vein here, and the anterior trunk directly enters into the cavernous sinus here. Here. So these are the tributaries of the cavernous sinus. If you see one by one is the superior ophthalmic vein. This is superior ophthalmic vein, this one. Okay, this one. This is the inferior ophthalmic vein, branch of the inferior ophthalmic vein here. Then the central vein of the retina, sometime here. Then the superficial middle cerebral vein. This is the superficial middle cerebral vein here. Okay. Then the inferior cerebral vein. This is the inferior cerebral vein. And here is the here the sphenoparietal sinus here. Okay, sphenoid on the parietal sinus here, and this is the branch of the middle meningeal vein here. Okay, or the anterior trunk of the middle meningeal vein. So these are the tributaries of the cavernous sinus here. Now what are the communication? This sinus communicates with the other sinuses or the other veins. How? Look here. First it communicates with the transverse sinus. Okay, look here. This is the transverse sinus. This is transverse sinus, and this transverse sinus continues as a sigmoid sinus. Okay, and this sigmoid sinus continues as a internal jugular vein through the superior bulb. So this is the superior bulb. Okay, this is a here. This is a transverse sinus. Okay, here. This is the sigmoid sinus. Clear? Here. So how it is connected here? This sinus, cavernous sinus, connected to the transverse sinus through the superior petrosal sinus here. Look here, which passes above the petrous temporal bone, upper border of the petrous temporal bones. Okay, so you can see here, this is the upper border of petrous temporal bone. There is a groove here, and through this groove, the superior petrosal sinus runs, and this superior sinus connect the cavernous sinus to the transverse sinus here. Clear? So it's important. Then through the internal jugular vein here. So the internal jugular, it passes, connect the internal jugular vein through the inferior petrosal sinus. So this is the inferior petrosal sinus. Okay, here. So this is the internal jugular vein, and this cavernous sinus connected to the inferior petrosal sinus. This internal jugular vein through the inferior petrosal sinus here. It's important. Then this sinus is also connected towards the pterygoid venous plexus here. Okay, pterygoid venous plexus through the emissary vein here. If you see in this diagram, suppose this is the sinus. Okay, this is a lateral view. Just if you imagine here, if you cut the skull, sinus is present here. Okay, here, and this sinus is connected to the pterygoid venous plexus. This is the pterygoid venous plexus here, which is present around the lateral pterygoid muscle here. And this this sinus connected through the emissary vein here. These are the emissary vein which passes through the foramen ovale, foramen lacerum, and the foramen spinosum. Okay, here. These are. So this cavernous sinus connected to the pterygoid venous plexus through the three emissary vein, especially passes through the foramen ovale, foramen spinosum, and the foramen lacerum here. Okay, yeah. So these are the communication with the pterygoid venous plexus. Clear? Then it also connected with the facial vein by the two routes here. This connected two routes. One is through the superior ophthalmic vein. Okay, superior ophthalmic vein, as you know here, at the angle of the this orbit here, angle of the orbit here, it is connected to the facial vein. Okay, so superior ophthalmic vein and the angular vein. At the angular vein here, at the angle of the mouth, angular vein start and facial vein start here. Okay, here. So superior ophthalmic vein here, through this sinus, through the angular vein, it is connected to the facial vein. One. Second is here around the pterygoid venous plexus here. There is a deep facial vein here, which connect the pterygoid venous plexus to the facial vein or the common facial vein here. Okay, so pterygoid venous plexus already connected to the this cavernous sinus through the emissary vein. So pterygoid venous plexus connect to the this facial vein through the deep facial vein. So on the both side, cavernous sinus through the angular vein and the cavernous sinus through the deep facial vein connected to the facial vein. So this is a connection here. Then with the opposite cavernous sinus here. This is the opposite cavernous sinus connected to through the anterior and the posterior intercavernous sinus. These are the anterior and posterior intercavernous sinus here. Okay, anterior intercavernous sinus and posterior intercavernous sinus here. Clear? So these are the anterior and posterior intercavernous sinus connect for this connection. Clear? Then it also connected to the superior sagittal sinus here. Okay, superior sagittal sinus is connected to superficial, this middle cerebral vein here. This superficial middle cerebral vein here also drain into the superior sagittal sinus here. Okay, so for the superior sagittal sinus, so the superficial middle cerebral vein here, this connected and superior anastomotic vein here. Superior anastomotic vein also connect the sinus towards the, it passes through the superior cerebral vein to the cavernous sinus here. So superficial middle anastomotic vein and the superficial middle cerebral vein, so two veins, this cavernous sinus connected to the superior sagittal sinus here. Okay, so these are the connection of the sinuses. Clear? Now, after this, if you see the clinical aspect here. Now, what are the factors? First is the factor how this blood passes, drains into the sinus. Due to the pulsation of the artery, you know the artery, the internal carotid artery is present in the floor here. Clear? So the pulsation of the artery, internal carotid artery, the venous blood in the cavernous sinus drains into the different sinus communication, ultimately drains into the internal jugular vein. Okay, so this is how the carotid, this blood in the venous sinus is regulated by the pulsation of the artery. Now, if you see the clinical aspect of the sinus, clinical aspect of the sinus is here. Now, sometimes this cavernous sinus thrombosis occur here. This cavernous sinus thrombosis occur due to the infection in the nasal cavity here in the tip of the nose, because it passes through the facial vein and the angular vein and enters into the. So lip also, infection in the lip, because it is a dangerous area of the face, it is also drained by the facial vein here. So at the lip or the face or the orbit also the pharynx here, in the pharynx, because in the pharynx the infection occurs. This infection passes through the pterygoid venous plexus and enters into the cavernous sinus. So either the face, in the tip of the nose, especially the lip, okay, and in the orbit, any infection in the orbit passes the superior ophthalmic vein, inferior ophthalmic vein. Any infection, if there is it may enter into the, through the pterygoid venous plexus, enter into the cavernous sinus. So if there is any infection occur here, so this may damage the ophthalmic nerve here, because you know the ophthalmic nerve traverses through the lateral wall here. Okay, here it irritates the ophthalmic nerve. So what's happened? There's a pain occur in the distribution of the ophthalmic division of the trigeminal nerve. So pain occur, or maybe the ophthalmoplasia occur, because there may be if the cavernous sinus thrombosis occur, it may damage the oculomotor nerve and the trochlear nerve, okay, and the abducens nerve here. So there's a third, fourth, and the sixth nerve may be damaged, and this gives rise to the ophthalmoplasia and the marked edema of the eye occur, okay, because the veins from the eyelid also drain here. So, and the second is in the fracture of the base of the skull. Suppose the fracture occur in the base of the skull here. So what's happened? There is a damage of the rupture of the internal carotid artery occur in the floor of the cavernous sinus. So if the internal carotid artery is damaged here, or the rupture occur, so arteriovenous anastomosis occur. Arteriovenous anastomosis occur here. And this arteriovenous anastomosis gives rise to the pulsatile exophthalmos. Okay, pulsatile exophthalmos. It means when there is a pulsation occur here, artery, so the eyeball comes outside and it moves out and in, out and in. So this is known as the exophthalmos, pulsatile exophthalmos occur here. Okay, so and also there is a murmur occur here, or the partial complete ophthalmoplasia also occur here, because due to the increased amount of the blood here, it compresses this now nervous structure in the lateral wall. So incomplete or maybe complete ophthalmoplasia may be occur. There's a murmur is heard through the stethoscope when we keep the stethoscope in the anterior to the eyeball. So murmur is there. Okay, yeah. It is now a systolic murmur or loud systolic murmur are there. Okay. So I think this is all about the clinical aspect of the cavernous sinus, and this is all about the cavernous sinus. Thank you.